If after performing the primary survey you find someone who is unresponsive and not breathing normally, call for help. Act quickly to call 999 or 112 and ask them to bring an automated external defibrillator (AED) while you can begin CPR immediately. If you're on your own, you may need to make the call yourself, ideally using a mobile phone on speaker so you can start CPR as soon as possible. You will need to start with chest compressions. Kneel down beside the casualty's chest. Place one hand in the center of the chest and place the heel of your other hand on top, interlocking your fingers to lift them off the ribs. Lean over the casualty with your arms straight and press down on the chest to a depth of 5 to 6 centimeters. Release the pressure and allow the chest to come back up without removing your hands. Repeat this to give 30 chest compressions at a rate of 100 to 120 beats per minute. After 30 chest compressions, you need to give rescue breaths. If you have not been trained, are unwilling, or unable to give rescue breaths, continue with chest compressions only until help arrives or the casualty becomes responsive. To give rescue breaths, make sure the airway is open by tilting the head back with one hand on the forehead and 2 fingers on the chin. Pinch the soft part of the nose and allow their mouth to fall open. Take a deep breath, seal your mouth around theirs, and blow steadily into their mouth for about 1 second, giving 1 rescue breath. The chest should rise. Remove your mouth and watch the chest fall. Give 2 rescue breaths in total. Continue alternating 30 chest compressions and 2 rescue breaths. If someone can help you perform CPR, you can swap every 1 to 2 minutes with minimal interruption to chest compressions. If someone is available to assist and has brought you an AED, ask them to turn it on and follow the instructions while you continue CPR. Continue CPR until emergency help arrives and takes over. The casualty starts to show signs of responsiveness, for example, breathing normally, opening their eyes, or you become too exhausted to continue. If they begin breathing normally again, place them in the recovery position, monitor them, and be prepared to restart CPR if necessary. To summarize, if you come across an adult who is unresponsive and not breathing normally, call for help. Ask someone to call 999 or 112 for emergency help and to bring an AED. If you're alone, make the call yourself, ideally using a mobile phone on speaker so you can begin CPR. Perform 30 chest compressions followed by 2 rescue breaths, continuing this cycle until help arrives or the person becomes responsive. If an AED is available, continue CPR while following the AED's instructions. And that's how we perform CPR.